You're watching 22 News in Focus. Today we are talking about the current status of the coronavirus in our region with Dr. Mark Kerouac, President and CEO of Bay State Health. Now, there's been many reports about vaccine trials and a possible vaccine before winter. Now, usually it takes years to develop a safe and effective vaccine. So is it possible that a viable vaccine will be available before the end of the year?
I would not think it's very right. There are a couple of vaccines that are in trials, and they really want to wait until they see the full potential rate of side effects, but they also want to show that the vaccine is effective. They've given half the group the vaccine and half the group just a placebo injection, and they're going to have to wait until the people getting the placebo have gotten a certain number of COVID infections, and all those people are trying to avoid getting COVID anyway, so it's going to take some time before you see the effectiveness data.
What are your concerns about fast-tracking a vaccine like this?
Well, I think you don't learn about the unusual side effects. Remember, this is something you're giving to a perfectly healthy person who could otherwise protect themselves by wearing a mask and doing the social distancing. So you really want to be really sure that it's safe. So if you rush it, you're going to miss the oddball infection, and you're not going to really understand how truly effective the vaccine is.
And what are you hearing about the effectiveness of immunity? Viruses usually stay in the body, so what are the chances of a reoccurrence in someone who's already tested positive?
Everybody who gets the infection develops some kind of immunity. The great majority of people, that immunity seems to be protective, and it seems to last at least for a while, at least for a few months. There have been a few very rare infections with people getting reinfected, that is second infection, but they seem to be very common. Initially, we confused that with the fact that people persistently test positive after an infection with little bits and pieces of the virus hanging around, even though they don't have infectious virus present in their bodies.
That was actually going to be my next question, because what if you did get COVID-19 early on in the beginning of the pandemic, and now we have all these rules in place if you travel out of state, for example. Some companies have rules in place if you travel out of state or go to one of the quote-unquote red zone states that you need to come back with a negative test. But if you've tested positive and recovered months ago, can you still get a positive test some 6 months later?
It is possible for people who've had an infection to continue to test positive for several weeks. And that's why we typically don't bother retesting people once they're recovering, because a positive test is not going to give us useful information. And so we tend not to pay attention to that.
Testing results have been a problem across the country with reports of many false positive, false negatives. Is there truly an accurate test out there, and is it available in our region?
Yes, the accurate and definitive test is the test for the virus's genetic material, RNA. And that is the test that you will get from any of the hospitals here in Western Mass. It is more than 95% sensitive, meaning less than 5% false positives, less than 5% false negatives, and it is the gold standard test. Problem is, it's cumbersome to do, and it's kind of expensive, and so people are really looking for tests that can be turned around more rapidly, that are every bit as sensitive, and are less costly. And we're working through some possible alternatives now, because more and more people are testing quite broadly, such as in the colleges and universities.
What about like the saliva test, for example? I know that there are a number of startups that are looking into this and testing these out. And I also understand that unlike the ones that you were just talking about with that 95%, the 95% effectiveness in testing, these ones are much lower, maybe down to 85%. What are the pros and cons in using a saliva test, especially when I'm thinking of a college campus, for example. If you were to say require each student before they go to class, take that saliva test and see what the result is before they move forward. Or maybe they're going to go out to a gathering of some sort. Before they go to the gathering, they take that saliva test and they know within, say, 15 minutes.
I think that if the likelihood that the test is going to be positive is relatively low, let's say you're testing several thousand kids at a college, and the positivity rate is a fraction of a percent, then something that's got a false positive rate of or a false negative rate of 10 to 20% is much less of a problem. And I think that a test or one of the rapid tests can be used effectively in that kind of a setting. When you're talking about a patient coming into the hospital who's got a cough and a fever and you really need to know, you can't accept that level of inaccuracy. But for broad screening of otherwise healthy people, it's not a bad strategy at all.
And medical professionals not immune from the virus, what preventative steps should medical facilities be taking now to protect their workers and patients?
Well, we've worked through a variety of protective measures right now in terms of cohorting patients as soon as they come in if they have any signs or symptoms of the virus. Everyone's wearing a mask at the hospital. Everyone is screened for fever symptoms. For people who have the infection, a high filtration mask is used, gowns, eye protection, and frequent disinfection of surfaces as well. So there's a whole bunch of protocols that are being used in the units taking care of COVID patients, which are over and above the usual disinfection measures we use for all patients in the hospital.
And are you guys allowing guests to come to the hospital, family members to visitation?
One visitor per patient, but that's really what we're limiting it to because we really want to try to keep the chances of infection low.
And then any concerns with PPE?
We're always concerned with PPE. I mean, it's been a constant worry for 6 months. Right now, we have 2 weeks supply, but we're constantly scrounging and wheeling and dealing to make sure that we have enough of the right stuff, not only the PPE, but also the testing material. Because if you run short on those, you can get into trouble as well. So for the moment, we're just fine, but we worry about it every day.
Well, the final words just after the break. You're watching 22 News in Focus.